Hello everybody, my name is John and I'll be talking to you about case number 3, adrenoleukodystrophy. The case is about two 28-year-old boys who are initially referred to the pediatric clinic for evaluation of behavioral changes. They were diagnosed with autism at the age of 3. In the last year, however, they have been demonstrating personality and behavioral changes. These are brings up gait and coordination and seizures. These symptoms are not typically seen with autism. It has been found that the boys have X-linked adrenoleukodystrophy, from the form known as ALD. The name comes from Dr. Michael Blau in 1871. Adrenal referring to the adrenal glands, leuko referring to the white matter of the brain, and dystrophy means abnormal growth or development. ALD is an inherited metabolic storage disease whereby a defect in specific enzymes results in the accumulation of very long-chain fatty acids in tissues of the body, especially the brain and adrenal. Ultimately, the myelin sheath that surrounds the nerves is destroyed, causing neurological problems, and the adrenal gland malfunction causes Addison's disease. There are 3 known prognoses at this time. Neonatal ALD, in which the disorder will progress very quickly until death. Childhood cerebral ALD, also known as CCALD, and the main one we'll be discussing today. This is thought to be the most common, usually affecting boys between the ages of 4 and 10, and is terminal and not diagnosed very early. It causes seemingly normal and healthy young boys to progressively lose all functions until they reach a semi-vegetative state. The last prognosis is adult cerebral ALD, or AMN. This is similar to childhood cerebral ALD, but affects adult males of any age. It actually is now thought to be more common and has been previously misdiagnosed. Onto the gene and chromosome. So ALD is an X-linked recessive disorder, which means that the genetic abnormality owns an X chromosome. Studies have shown mutation to take place at DNA marker XQ28 in the ABCD1 gene. As you can see, the marker, the DNA marker XQ28 is the very end of these genes. The etiology of X-linked ALD. There's over 600 known different mutations for this disease. 56% of those are missense, and 30% of those are franchise. Those are the 2 most common mutations that occur in the ABCD1 gene that causes this. The ABCD1 gene provides instructions for producing the ALD protein, which is involved in transporting certain fat molecules called very long-chain fatty acids into proxysomes. Proxysomes are the small sacs within cells that process many types of molecules, including the very long-chain fatty acids. The pathogenesis. ABCD1 gene mutations result in a shortage or deficiency of the ALD protein. And this protein is lacking in transport and subsequent breakdown of the very long-chain fatty acids is disrupted, causing abnormally high levels of these fats in the body. The accumulation of the very long-chain fatty acids may be toxic to the adrenal cortex and the myelin. Research suggests that the accumulation of the very long-chain fatty acids triggers an inflammatory response in the brain, which could lead to the breakdown of the myelin. The destruction of these tissues lead to the signs and symptoms of ALD. Incidences, there's about 1 in 17,000 chances of a child being born with this modified. It is also not ethnic-based, so any ethnicity has the same exact chance of getting this disease. The phenotypes, as I talked about before, we are talking about the childhood cerebral ALD. The main ones are behavioral changes, impaired vision, hearing and coordination, severe disability, weakness in arms and legs, and impaired consciousness, and usually within 2 to 4 years after these symptoms start showing down. Diagnosis. So the boys with symptoms of attention deficit disorder would in addition show signs of dementia, progressive behavioral disturbance, vision loss, difficulty in understanding spoken language, words in handwriting, and coordination, or other neurological disturbances will be diagnosed with this. There is some neuroimaging. Brain MRI is always abnormal and neurological symptomatic. also paternal prenatal testing that is possible for pregnancies of women who are carriers and who may risk having an affected by 25% or 50% of the fetus is unaffected. The usual procedures is to determine sex by karyotyping the fetus cells obtained by embryonic villus sampling, which comes about 10 to 12 weeks gestation, or by the amniocentesis at 16 to 18 weeks gestation. Disease management, there are really four different ways of treatment. There is no cure. The first one is adrenosteroid replacement therapy. This is mandatory for those patients that have the adrenocortical insufficiency or Addison's disease. This may be life-saving, but it has no effect on neurological symptoms. There's hematopoietic stem cell transplantation. This has been demonstrated to be successful in arresting disease progression in a small subset of young pre-symptomatic patients with demonstrable early signs of cerebral demyelination. So this is good if they catch it early. There's a Lorenzo's oil that does not help with neurological symptoms. And most recently, there has been some gene therapy that Dr. Natalia Cartier and Patrick Alborg at St. Vincent de Paul Hospital in Paris have successfully treated 2 7-year-old boys with early signs of cerebral ALD. This is still very early in testing, but the brain MRI scans and cognitive tests show the progression of cerebral ALD stopped after 14 to 16 months. So it was good news there. Inheritance. So I did diagrams of an unaffected mother, an affected father, and an unaffected father, and a carrier mother. So if the woman is the carrier for XALD, she has the following possible outcomes with each newborn. When the child is a daughter, there's a 50% chance that the daughter is a carrier for ALD, and a 50% chance that the daughter is affected. In any case, the child is a boy. In case the child is